Hello, and welcome to another All of Us Research Program Fireside chat series. It is a real pleasure to be here with amazing panelists, and we are going to talk to so many things today. So the National Hispanic Medical Association welcome all of you to this webinar and this series. Please stay tuned, and I'm going to give a little bit of introduction. If we can go to the next slide. So my name is Ricardo Correa. I'm an endocrinologist and diversity director for GME at the University of Arizona College of Medicine in Phoenix and the Phoenix VA. I also work as a medical director for an underserved clinic in called Patch Clinic in Phoenix, Arizona. So some housekeeping, please follow the questions and answers after the presentations. So we will have a specific time for that, and you can use your Q&A box located in the bottom of the Zoom for this. The microphone will be muted for everybody, and recording will be available in the NHMA webpage starting next week. And the webpage is nhmamd.org, nhmamd.org. So today I have the pleasure to be with four amazing panelists. I will present it right now, and then we will start in the order of their presentation. So we have Dr. Adrienne Roman. She has been a member of All of Us Data and Research Center since January of 2020. She is a research support and outreach project manager. She has been involved in the creation of training and education material to support researchers and facilitate successful utilization of the research workbench and All of Us data set in the research. We have Dr. Melissa Simon. She is a George Gardner Professor of Clinical Gynecology, Vice Chair of Research in the Department of Obstetrics and Gynecology at Northwestern University, Feinberg School of Medicine. She's also the founder and director of the Center for Health Equity Transformation and the Chicago Cancer Health Equity Collaborative. She's a member of Illinois Unidos, and she currently serves as one of the community engagement co-leads for the Illinois Consortium of all of and delivery system use. She has expanded her research focus to include mental health. Through her research, she has investigated the influence of loneliness on alcohol and access healthcare among Chicago residents. Her research also focused on understanding the relationship between acculturation and mental health among Hispanic Latinos from diverse ethnic backgrounds using data from the Hispanic Community Health Study of Latinos' Soul. And Dr. Courtney Wallin joined the NIH All of Us Research Program Division of Engagements as outreach lead in July of 2020. In her role, she leads effort to raise awareness about the value of All of Us data set and engage diverse researcher communities. Prior to joining the program, Dr. Wallin held a position at the National Institute of Aging, where she worked with a variety of stakeholders such as Congress, health and research advocates, non-governmental organizations, and federal partners with the interests of aging related to research and public health policies, including Alzheimer's disease. So as you can see, amazing, stellar panelists that are going to give us more information of All of Us research program today. So if we can see in the next slide, we're going to start our conversation with Dr. Courtney Wallin and Dr. Adrienne Roman. So the floor is all yours.
Wonderful. Thank you for that kind introduction. And so thrilled to be here today to share with you some details about the All of Us program and the Research Hub in particular. Next slide. Here's a brief outline of the hour. I'll share with you a brief overview of our program and then turn it to Dr. Roman to walk through components of the All of Us Research Hub before having a thorough discussion with all the other panelists. Next slide. First, I want to start by thanking our community and provider partner network, a network of our trusted partners who we work with to help promote the value of the All of Us program throughout the country. And this, of course, includes the National Hispanic Medical Association, who has invited us here tonight to participate and is putting on this fantastic Fireside Chat series on the program. Next slide. And I'd like to also thank all of our consortium partners shown here. It's a robust network who truly make this program possible. Next slide. So to begin, the All of Us program is an innovative and unique endeavor. First, one of our primary core values is to ensure our participants reflect the rich diversity of the US. All of Us plans to build a cohort of 1 million or more individuals with an emphasis on including communities that have historically been underrepresented in biomedical research. We're also working to build a community with a focus on participants as partners. And so this means that All of Us includes participant representatives in every level of our program, including in our governance structure. We're also very committed to returning information and research results to our participants. Understanding health, including healthy aging and wellness, has time as a factor. And so hence the longitudinal design and effort to collect information over time. We're also committed to creating a rich data set of multiple data types, including electronic health records, surveys, baseline physical measurements, and biospecimens, which includes genomics. And our aim is to have a national open resource for all, and that's the Researchhub, which Dr. Roman will speak about in just a bit. It's a resource open to all researchers, and that means that both traditional academic researchers and in the future interested citizen scientists as well as curious participants. And of course, security and privacy are a core value of this program. Data are stored in a secure cloud-based database, and we are applying the latest technology measures to ensure security and privacy of our participants' data. Next slide. Our mission is to accelerate health research and medical breakthroughs, enabling individualized prevention, treatment, and care for all of us. We're achieving our mission by nurturing relationships throughout different communities and with individuals from all walks of life. And we're aiming to earn trust of these communities, specifically those groups who have been historically underrepresented. We're also catalyzing a robust ecosystem of researchers and partners, building a strong internal team to carry out the mission, and delivering the largest, richest biomedical data set ever, which again, Dr. Roman will speak a bit more about in just a moment. But before turning to her, I do want to emphasize that we're here today to talk about the research, but in doing so, we still have our full mission in mind, so including all 4 of these components. And on the next slide, this goes and just underscores, next slide. Thanks. Underscores that we're absolutely committed to ensuring the diversity of our participant cohort as well as our researcher cohort, so the researchers who are on the data platform. We want to engage diverse communities, not only as participants, but researchers who are bringing perspectives informed by a broad range of expertise and experiences. So we're, as detailed here, we're committed to creating a demographically diverse research cohort who can promote the ethical use of our data and generate new outcomes that can return the greatest value to our participant communities. And we're committed to engaging and encouraging students and early career investigators to bring their fresh creative perspectives and propel innovative research outcomes. And additionally committed to ensuring access for researchers from all types of institutions and organizations so that we're truly building this equitable resource for all. And with that, I'll turn to Dr. Roman to dive into our research hub.
Thank you, Courtney, and I'm very excited to be here to speak to you all today about the Research Hub. Next slide, please. So the Research Hub is a secure, publicly accessible Google Cloud platform where researchers can learn more about the data available in our researcher workbench for analysis. This schematic graph shows how the Data and Research Center collects and curates the data from all of our participants for our All of Us data sets, and then how they're made available to users on our publicly accessible site, as well as in the researcher workbench. So our research participants provide data through a collection of participant surveys, electronic health records, physical measurements that are taken at the time of enrollment, They also have the option to link their wearable devices, such as Fitbit, and provide biospecimen samples. These data are then stored in what we call the raw data repository at the Data and Research Center, where they then go through data harmonization processes. They undergo conformance checks. We remove any participant identifiers and also apply additional privacy methodology to these data. Then they get moved into our curated data repository, which we call the CDR. And this is where the data set that is accessible to researchers is that you can access through the Researchhub. So next slide, please. So now I'm going to walk you through our Researchhub, what that is, what all the components are. I encourage you to follow along by going to researchallofus.org. I won't be able to show you everything today. I'll just be highlighting some of our favorite pieces and some of the more useful ones we think you might enjoy using. But there are a lot of great resources, so please check it out if you haven't done so already. So next slide, please. The Researchhub contains both public and restricted components. The publicly accessible portion of the Researchhub provides researchers, participants, and the public with general information about the program, privacy rules, and data access. It also provides detailed information about the types of data sources provided by participants, as well as methods used by the program to curate these data. Direct access to custom tools designed to help you explore the aggregated research data, which includes our data browser and our Survey Explorer, and also frequently asked questions and a monitored help desk. The restricted access portion of the Researchhub contains our researcher workbench. This section requires a user to register in order to gain access and provides researchers with further access to data, as well as initial sets of tools to analyze these data within the Workbench platform. And more tools will be added over time. We've also adopted what we call a data passport model to facilitate and encourage use of these data. After researchers register, agree to our rules, and complete training on the responsible conduct of research, we'll grant permission to these researchers to explore the All of Us data set for a wide range of studies, rather than determining access for studies on a project-by-project basis. Next slide, please. So here's our Researchhub landing page. The Researchhub, again, is where participants and researchers can really begin to interact with the All of Us data set, including exploring the types and quantity of data collected from participants. We hope that by making these diverse data available here, that it will help facilitate new studies that could lead to new insights and treatments, strategies for disease prevention that are tailored to individuals. So I'd like to take an opportunity now to really highlight some of the parts of the Researchhub, starting with our data tools, our data and tools section. Next slide. The data and tools section of our Researchhub is where we will be providing you with information about data releases, when we add new types of data, when we add more data to our data set, as well as where you can find the tools for exploring data available to researchers on the public site. And if you scroll down while you're on this page, you'll see that it includes using our Survey Explorer to learn more about the surveys offered to and completed by participants. You'll also see a section that where you can find our data access and use policies, information on the types of data provided by participants, and our data curation methodology and program protocols. And if you're interested in finding out more about the participants themselves and who's enrolled in our program, you want to go to our data snapshots page, and that's what I'm going to show you next. The data snapshots show the scale and diversity of the All of Us research program participant cohort. So this snapshot provides metrics of participant enrollment counts over time, participant demographics, geographic distribution of all of our participants, and more. So when you scroll down on this page, you'll see all these different graphs and really helpful information to understand who's enrolling in our study and participating. And these snapshots are updated daily, so you can get really accurate counts very fast. Next slide. And since diversity is the core of the program, we really wanted to kind of emphasize how diverse our data set is. In the US, individuals with non-Caucasian backgrounds are estimated to be greater than 1/3 of the population. And this graph represents the self-reported races and ethnicities of participants who've completed the initial steps of the program based on their responses to the basic survey. Each participant who's answered the survey is counted only once in the counts that are shown. And if a participant selected more than one option, they are shown in the category of more than one race or ethnicity reported. But as you can see, we do try to really emphasize recruiting a diverse group in. And in the next slide, You'll also see that we have a well-balanced distribution across age and geographic area as well, with participants from all 50 states. So we'll continue to grow by opening new clinic sites around the country on a regular basis. To reach even more communities, the program has an interactive mobile exhibit that travels across the country. The program provides bilingual support and allows participation by any interested individual through the direct volunteer pathway. Next slide. A unique and valuable tool that we offer users through the Researchhub site is our data browser tool, which allows researchers to explore and interact directly with our data. While data snapshots show you more general participant metrics, the data browser lets you dive into those data and provide you with more detailed metrics that are probably a little more helpful in terms of developing your research interests and questions. So currently, participant provided information, including surveys and physical measurements taken at the time of participant enrollment, as well as electronic health record data and wearables data are available. In the data browser, you can also search for conditions of interest to find out how many participants have those conditions reported in their EHRs or that are self-reported in surveys, and the associated concept codes. In order to protect participant privacy, though, the data on this public site are de-identified, limited to aggregated counts that are rounded up to 20 and show only summary demographic information. But the data browser provides really useful information to researchers, gives them an opportunity to dig into the data a little more to help promote hypothesis generation for research and also assess study feasibility. Next slide. And if you're interested in how researchers are actually using participant data, definitely check out our research projects directory. It's an excellent resource. Approved Workbench researchers are asked to complete a workspace description with each new project that they start. And this is information that we make public here. This information includes their research purpose, description, population of interest, etc. And collecting and publishing this information helps the All of Us program ensure transparency on the type of research that's being conducted. So even if a researcher creates a workspace just to explore data, to test new coding, you'll be able to see that within their workspace description. We publish everything. At this time, all of the projects that are published are using our registered tiered data, so that restricted access data. And next slide. The Researchhub is also where you'll begin your journey to gain access to the All of Us data set and become a registered researcher. On the application page, you'll be provided with information about what it means for the researcher workbench to be in the beta phase, and also a detailed outline of the All of Us application process. To apply for access, you need to make sure your institution has a signed data use agreement with the program, and you need an ERA Commons account, as well as being affiliated with a US-based institution. And once you've checked all these boxes, so to speak, you'll be able to register and create an account, complete the All of Us Responsible Conduct of Research training, and sign a data user code of conduct. So if your institution already has a DUA in place, this training can all be completed comfortably within 2 hours. Next slide. And once you've completed the steps to become a registered researcher, you'll have access to the researcher workbench where you can begin research by creating workspaces, accessing point and click data analysis tools unique to the workbench, such as our cohort builder for selecting participants to include in your data set and concept set selector for selecting data to be included. We also use Jupyter notebooks for analyses. And to help familiarize researchers with the All of Us dataset, the Data and Research Center provides researchers with featured workspaces found in our workbench. The featured workspace section is a library of example workspaces and analyses completed by our research demonstration and support teams. These workspaces were created to show researchers how to use our data. One that I find incredibly helpful is called Data 101, and it's a tutorial that shows you how to set up a notebook, install and import software, summarize your cohort of participants in terms of demographics or data types of the counts of data types they have available, lets you delve deeper into data availability and explore how those data are organized. And researchers can actually pull codes from our example workspaces into their own notebooks and use them for their own analyses. And the User Support Hub is another great resource for information on how to get started within the workbench. We have additional documentation around privacy policies and methodology. There's also a forum where you can connect with other researchers within the workbench, as well as our research support staff. We have FAQs that we create and update based on feedback from our users and tickets that are submitted to our help desk. And it's a place to also hear about announcements related to data releases, security, and updates on the platform. Next slide. And I mentioned before that All of Us Researcher Workbench is in beta testing. This means our product is still growing and evolving, including the data set itself. New data will be refreshed and added regularly. The cadence right now is about 2 times a year. We're not waiting until the end of data collection to share these data with researchers, and by sharing data early and often, we can get useful feedback to help make the All of Us resource more valuable as we go. Over time, we'll add data from genomic analyses, wearables, and more, plus tools for analyses. We also have a set of resources available through a variety of methods to help guide researchers through their journey, and those will also be continually updated through the life cycle of the program. Next slide. And with the Workbench being in beta testing, there are some considerations to keep in mind. Currently, researchers must be capable of working in R or Python to analyze these data, and at this time, we use Jupyter notebooks for our analysis environments, and right now it currently just supports R and Python languages. Additional analytic tools will come later, though. Researchers may apply for access to the Workbench if they have an ERA Commons account, are affiliated with a US-based academic institution, healthcare institution, or nonprofit that have a signed data use and registration agreement. And as we continue to grow and evolve, we also really want to hear from the researchers themselves during the beta testing phase so that we can make the Workbench more robust over time. And lastly, to learn more, please visit the researchallofus.org and join allofus.org sites. They have really great information on the program and the Workbench. If you also are at an institution where you would like more information or have someone to come and talk to your team about the Workbench itself, you can request a Workbench demonstration at the website listed on the 3rd bullet. And if you would also like to enroll as a researcher yourself, the link is also there at researchallofus.org/apply. And any additional questions, or if you'd like follow-up conversations, please reach out to our colleagues Courtney Wallin and Ashley Green at the emails provided.
Now we have I invite to the floor Dr. Simon.
Hey.
Can you hear Dr. Simon? Yes.
Oh, yes. Hello.
Hello, how are you?
Good. How are you?
Can you give a brief overview of your work in related to Latino communities in Illinois?
For sure. So I am an obstetrician gynecologist at Northwestern Feinberg School of Medicine downtown in Chicago, and I lead the Center for Health Equity Transformation. I have a large portfolio of research that's partnered with communities across the Chicago area with patient navigation and helping guide Latino communities, African-American communities, and Asian, specifically Chinese communities through cancer care and delivery, and also through perinatal care. I'm also a member of the All of Us team for the Illinois Medical Consortium around, I help work with the team on community engagement and work to focus on how we as researchers can do a better job of really connecting with communities and trying to meet them where they're at and give them accurate information about participation in clinical trials and dispel the myths about research and participation in research. And that's been really, really important, especially as we move through the COVID pandemic. The other thing we do is partner with libraries and other community organizations that are considered more safe spaces, especially across the Latinx communities in Chicago and around the surrounding suburbs and state to really get the message out about, again, clinical trial participation, preventive health. Right now, we do a lot of vaccine knowledge work. And so that's been a really important way to connect with Latinx communities and healthcare providers, actually, the primary care providers around the city and the surrounding areas. And then one last thing, I do a lot of work with the United States Preventive Services Task Force. And so part of my job over that last 4 years was to really understand how we can do a better job of bringing, of looking at the data for all groups across the United States and really seeing where recommendations that we make for primary care and preventive services fall short when it specifically comes to racial and ethnic minorities and especially Latinx populations. And then not only where they fall short with respect to the lack of data that we have because of the lack of participation in trials and because of the lack of trials that include racial ethnic minorities, but also the area of implementation of those guidelines. So those have been some of the top things that we do on our team in Chicago.
Thank you so much, Dr. Simon, for that experience. And now I would like to bring, we'll have some more questions for you, Dr. Simon, at the end, but I would like to bring right now Dr. Lozano so she can give us a brief explanation of her work in the All of Us research program.
Okay, hello everybody. Thank you, Dr. Correa. So as Dr. Correa had mentioned previously, I started working with the Latinx community, looking at tobacco use and e-cigarette use, and now I'm working at the University of Chicago Medicine, identifying health disparities within the Asian population. So in this work, we collaborate with the Asian Health Coalition, which is a community-based organization that works to promote well-being among Asian Americans in Illinois and beyond. And I think, that's something I did want to highlight. There's community-based organizations that work with the Latinx community, in this case with the Asian American communities. And I think community-based organizations have a unique, they're unique in that they have a direct link with the community. So they have a lot of knowledge and experience and understanding on like the community's culture, their norms, their beliefs, and their health. And so they have all this information, but sometimes, they may not be in the position to disseminate the research. And so we are working together with the Asian Health Coalition to move research forward. So within our work, one of the things that we're doing is examining if the Asian American sample in all of us is representative of the general population in the US using the census data. And so this is important because we know that Asian Americans, along with other minorities, have been underrepresented in research, in health surveys. And one of the reasons is because the surveys are usually in English, in Spanish, but not in Asian languages. And some Asian groups have limited English proficiency and limited or low levels of health literacy. And so they're excluded from this data. So we wanted to look to see if there was representation and then also identify barriers to recruitment of these groups.
Thank you so much, Dr. Lozano. So now it's time for the most enrichment part of this conversation, that is the questions and answers. So remember, please, if you have any question, write it in the Q&A and I will go through them. So first, to start, some of the questions, these go for Dr. Lozano. What are the limits of aggregate data set when it comes to analyzing health inequities? Can you speak to your experience working with the Asian American community and how you have seen this play out?
So something that has been for me inspiring about working like along with a community-based organization is that, so I think sometimes like being a researcher, when you approach research, you look at what are the gaps in the literature. And so when like working with community-based organizations that like work directly with the community, they're looking at what are the needs. And so I think, you know, like it's important to move research along, but it's important to generate an impact. And I think, you know, like we need to know what are the specific needs. And when we do that and we do it through research, then I think we're moving health equity.
Yeah, and I agree with you. It's we integrating the community to our setting in the research world. It's very important, and trying to facilitate through different mechanisms how they understand what we're doing. It's very important. Talking to really similar but with a different population, Dr. Simon, can you talk a little bit about the challenge that exists with the Latinx community to in being involved in research, and how have you overcome this in your setting?
Yeah, I think it's really similar. Again, you know, oftentimes when things are translated, they may not be translated in the best Spanish if they are translated. The other issue is the fear of participation in research, especially if there's documentation or immigration issues, whether it's for the direct patient or participant themselves or for anyone in their family. And so that's a real issue. And, you know, we can't forget the very severe treatment, really just unacceptable maltreatment of people in the healthcare system and the science over centuries, and including a variety of Latinx populations that have either in Puerto Rico with the birth control pills and experiments in the 1950s, forced sterilization as recent as last year. I mean, it's egregious maltreatment. So we have a lot of barriers to overcome with respect to trying to engage people of color in general, but specifically Latinx population in research, period. And so those are really important things. In terms of data aggregation, it's a misnomer to think that Latinx should be in one category. There's a lovely, wonderful, beautiful heterogeneity of us Latinos, and we need to embrace that. But then it's very hard to collect data by specific country of origin, ethnicity. So that becomes really hard with respect to the number of people you need to participate to actually be able to look at that heterogeneity within just the Latinx, or for that matter, Asian populations.
Yes, totally agree with you, Dr. Simon. And something that you mentioned that is very, very important is that piece that we started talking about many years ago, and now last year with all the events continue talking, is this racism in medicine. And it's not just in clinical medicine, but it's in research, and all the mistrust that the Black and brown communities have with regarding events that happened in the past. And we as the new scientists and new era of clinicians need to overcome that. And the way that we communicate it is so important. I was looking at even publications, racism in publications, and I don't know if you remember this event that we had an article published last year in one of the prestigious journal about the women's in Asian women's so one was in Asian women, the other was that Black African Americans are more predisposed to COVID-19 because they have more ACE receptors in the nose. And this was published article in a prestigious journal without looking back of how race is affecting that article, without having data on race. And now we are trying to come with a in the publishing area with a statement to see, let's see if it's flow, that is to have a diversity editor or an associate editor for diversity that looks in detail on how that research was done and how they include different race and ethnicities. So going into this direction, I want to ask all of you, if you can give a little bit of views on why it's important that underrepresented communities participate in research, and why is the benefit, what is the benefit for the future generation about this? We can start with you, Dr. Roman.
From a researcher perspective, I think it's just critical that we make sure we represent everybody, and especially with the history of you all, as you all mentioned, underrepresented populations, that we really can't be offering treatments to individuals when we don't actually utilize data from all individuals. And so I think that's just at the core of what our program is looking to help fix. And I think it's a very critical issue to highlight, especially moving forward in advancing medicine.
And to piggyback off of that, you know, as we've been talking about, several groups have been left out of research in the past, and so they haven't had the benefit of research results that are either returned to them, of course, but in general, research studies informed by where they live, who they are, and I think in order to progress and, you know, inform personalized medicine, ultimately, we must have a diverse cohort of participants, and looking across all factors that make individuals unique. And what researchers can learn about you today can certainly lead to better health for the generation. Learning about your genetics can impact. Learning about your height and your weight and your blood pressure can all certainly have an impact for generations to come.
Yeah, I think it's nothing about us without us, right? Whatever we as scientists put into the research, whoever participates, or whatever blood from wherever we get, or the samples from wherever we get, whomever, that research is only going to represent those who participated, or those samples that were brought to the bench to do the research. So the output of that research is only going to be applicable really to the people who participated. And so if Latinx, for example, populations do not participate, then the research or the therapeutics, the drugs that are developed, the vaccines that are developed, everything is just may not work for them, or maybe the wrong dose or the wrong, formula altogether. So that's why participation in research is really important.
And also, something I was thinking is, we know as researchers that it is important, but I think that there's we also need to increase the trust in the community, so that they also see the importance, but they increasing the trust are more likely to be engaged in biomedical research and other types of studies like this.
Definitely. And just going back, we know that this is the problem, that underrepresented communities are not involved. But I know that Dr. Simon has been working very hard in Illinois to make the Latinx community get involved. Can you give us some of your pearls? How do you have been successful involved in the Latinx community? And if any, after Dr. Simon, if any of the other panelists want to give any of the pearls that you have done to get involved this community and overcome this difficult communication that is to get involved in research.
I've been present in Chicago for a very long time, and have been doing a lot with a variety of very wonderful community organizations that are considered well trusted within each of the parts of the Latinx community in Chicago. And that's really critical. And when I say I'm going to show up, or when my team and I say we're going to do something, we do it and we show up. And that takes time. You can't just, fly into, a community organization or a church or an event and say, hey, I'm Dr. So-and-so, and I'm a scientist, and I work at Northwestern, and I have fancy NIH funding, and you need to participate in research. That ain't gonna work. And so it takes time, it takes humility, and, you keep working at it, and people can tell if you're a good person. You can sense it. And then you have a team, right? Team that speaks the language, that understands the culture, that also you do programs that also help benefit the community as well. You got to listen hard.
Any other Paula Lozano?
I just wanted also, like, thinking about this. So the Asian Health Coalition is also a national engagement partner. So recruiting Asian Americans across the U.S. for to get involved in all of us. And so I think something that we have done is to, from one part, like, make a connection between the health providers, or the ones that are principally responsible to recruit, like, participants for all of us. And so creating that link, like, creates also that trust. And so from one part, like, community-based organizations that work directly with the community, they can learn about the process, but also I think it's important to educate health providers on a culturally tailored ways to approach these communities, so that they don't feel like there has been this history of discrimination, racism, so that, like, those things needs to be addressed, so that when they address them, they, like, there's a good communication.
Yes, so now let's continue this conversation, but jump a little bit and seeing regarding for Dr. Wallin and Dr. Roman. Can you tell us about how all of us research is adapting to the empower researchers during COVID-19? We know that to a certain point, COVID-19 has affected the research, or closing our clinical research centers, or limiting the access to patients. Even the IRB process, it's delayed in many areas, just because they don't want you to bring any patient that is not special or have some issues with the hospital. So can you talk about that, and then discuss a little bit about the COPE survey?
Absolutely, yeah. I'd be happy to start us off, and then Dr. Roman can chime in. But to your point, though, COVID has limited some in-person touch points. It's actually opened doors for new virtual outreach opportunities. And so we can engage specifically from a researcher outreach and engagement perspective to engage a range of researchers across the US. So while in-person data collection and normal lab-based research may have paused, we can actually encourage researchers to come to our platform and leverage our diverse data set during the pandemic. We as a program have also taken some steps to help researchers learn more about COVID-19 and how it's impacting communities across the US. Including doing antibody testing. We have tested samples from participants who joined early in 2020 to help researchers better understand the spread of COVID-19 in the US. The COPE survey, which you had referred to, the COVID-19 survey, we've reached out to all participants about and inquired about the aspects of the COVID-19 pandemic in our COVID-19 participant experience, or COPE survey, which includes physical and mental health, employment, income, and substance use questions. And we also are getting some EHR data standards, gathering COVID-19 information from participants' electronic health records. Dr. Roman, I think you can speak a little bit more to the COVID data that's on our platform now.
Yeah, and thank you for the nice summary of kind of talking about the COPE survey data. We do have that available in our data browser, the publicly accessible tool, so you can look around, kind of see how those responses have been collected. Also, one really interesting thing is it's a longitudinal survey, so we have participants come in and they're able to complete it more than once. So you can actually see how their responses change over time. We can actually see how our participants are affected by the COVID pandemic just by looking at their change in responses. So that's been a really informative tool for us to use. And we will be including, and that survey is also available in the Workbench, and we will be releasing the entire survey and including COVID positive status information and serology data in our controlled tier, which will be hopefully released later this year, although it's the exact timeline is still to be determined. And then one other really exciting incentive that we've received, we got a gift of $125,000 in Google Cloud Platform credits. So when you work in our Workbench, especially during beta testing right now, you are given free $300 in free credits to pay for your research. Even though access is free, you pay for computational cost of running analyses. They're still very, very small, very minor. I mean, you can complete an entire project for about $15. But we did receive a gift to help cover those computational costs associated with COVID-19 research during this calendar year. So it's really, the gift was intended to speed up scientific research and discovery to fight COVID-19. And you know, if you're a current researcher, please check our announcement sections. We'll be providing more information about a seminar discussing this. And then if you're not, it is still open to you. And you know, please register for the Workbench so that you can access these data. But we're really excited and hope that that will also encourage more research to provide information about this pandemic.
And also, I'd be remiss in mentioning that, of course, COVID is disproportionately affecting people throughout the country. And we are really encouraged and excited to have these, the COPE survey and release these data on our platform, because we do hope what we can find out can truly help.
Yeah, so thank you for that information. Now I would like to ask all of you what you will say to a medical student, because we have so many medical students that are interested on helping on health inequities. What are the things that you will say to that medical student or that young scientist about what they can do in thinking in addressing health inequities?
There's so much you can do, and you've got energy, and please, we need your energy because some of us are getting old and need help. But there's so much to do, and you know, it's that there's the research part, there's community outreach, there's volunteering, there's clinical care, there's advocacy, and there's, you know, going to the Hill and advocating for laws and all that kind of stuff. So there's, you have to figure out, and you can try a little bit. That's the best thing about medical school is you can kind of, it's like a buffet. You can try a little bit of everything and see what you like better, right? And that helps tee you up for when you go to clinical residency, and then you try a little more and see if you like to do research, or if you prefer just advocacy or a little bit of both, like what I do. But you know, don't force it, right? If you don't really like doing research, also understand there's so many different types of health equity related research. Health equity lens needs to be in every single type of research there is. Just like for the All of Us study, health equity is essential, right? And that part of that health equity is good community engagement, good practices with translation, research staff that are culturally congruent and culturally responsive to different populations. I mean, all of those things on how to partner with communities, like how to do that. So all of these things are super important for consideration. So there's so many opportunities, really there are, and you've got to just find mentors who can help you guide you through the process.
No, and also just wanted to add, you know, as a graduate student, you know, like as Dr. Simon was saying, there's like so many things that you can do. Is so many, like, research is so broad. So like you can start thinking that you have a lot of liberty to see what is it that you like, and like you can just go online and see what, you know, what other professors or other people are doing maybe within your university, and you can email them. And like from my experience, like I always, most of the time when I emailed, like when I was a graduate student, even a master's student, like I would email a professor, I would get a response. And so, you know, I would meet. And so like that I think that's helpful.
And I couldn't agree more. I think, you know, following your interests and exploring where mentorship may be possible is key. I would say from the All of Us perspective, just begin to explore our researchabus.org and the publicly available data browser and other data and tools that are available publicly at the moment, and then consider potentially registering for the Workbench if that research is potentially appealing to you. I think there's this, as Dr. Roman had mentioned earlier, this platform is just going to continue to grow, and we hope to break down barriers to access and increase more data and tools and really create quite an equitable platform. And we would love to see dissertations to come off of this. And you know, I know from my perspective as a student, sometimes it was difficult to find data, even to do secondary data analysis. And so we do hope this is a true open resource for all, especially students.
Yeah, so I think that this is something that we have to do as mentors, translate our passion to these mentees. Because I feel that when I talk to them about, hey, let's do this healthcare disparity research, and I'm doing this, but with a positive attitude, and not like, oh, because we need this information, and then that's why I'm doing. Then I think that you engage more the medical students and the scientists. So I have a question from the audience. They're asking, is there any cost for a university to be part of the partners?
If you're talking about engagement partners, there's an application process for funding opportunity applications. But if you're speaking to university being part of the data use agreement, there is no cost associated with that. And I think Dr. Roman can share the link to potentially enroll onto the Workbench and have that data use agreement established.
Thank you. So any other questions from the audience? I know that we are almost on time, but I want to have a little bit of time so our panelists can say some final words. So yeah, so well, before we end, and I know that Dr. Roman and Vincent has been putting in the chat box some webpage information, so you can take a look to that. So before we end this Fireside series, I want to ask each one of you to see if you can have a final remark on this, or why you think that we should continue promoting this, or what is a little bit of the last pearl that you want to leave the audience with. We can start with Dr. Lozano.
So one of the things that I find really appealing about this data set is that it's going to, at one point, you know, like it's going to be disaggregated, and we're going to have data, you know, by race, ethnic, like by different subgroups, for example, in the Latinx community, in like the Asian American community. And that is so important. So when I used to do like research in the Latinx community, like I work with tobacco, and like, for example, the prevalences of smoking among Puerto Ricans and Mexicans is completely different. And you know, there's very little research that you find looking at different race, like looking at subgroups, like disaggregated data. And that is the same case with like the Asian American community. And there's like so many groups, so many languages, religions, reasons for coming to the US, and that is all going to influence health. So I'm really excited that this data at one point is going to be disaggregated, and we're going to be able to get results by those groups.
Dr. Wallin?
Yeah, and to piggyback off of Dr. Lozano, I am just so thrilled and excited about the potential of the All of Us Research Program data set and the platform and potential data and tools that are coming out. As actually Dr. Simon had said earlier, it is key, you know, nothing about us without us. And I think it's so critical here to, you know, we have collected this robust, diverse group of individuals to participate in this research, but we want to ensure that we are returning the most participant proximal results and releasing outcomes that are meaningful to our participant communities. And so we want to sincerely encourage researchers from participant communities to participate in this research as researchers as well, and produce fascinating, unique outcomes for years to come.
Thank you. Dr. Simon.
I think another part of research participation that I don't know if we've mentioned strongly enough is actually primary care physicians. And just healthcare providers in general. We know that patients, regardless of where they're from or who they are, will tend to be willing to at least listen about a particular research study and be more likely to participate in a research study if their physician or their primary care healthcare provider recommends it. And this is remarkably powerful. So I know there are a lot of healthcare providers and physicians on the phone, on the call today. And if there's anything I can give a message out to is introduce the study, talk about it. But first you have to be convinced that it's a study worthwhile participating in. So if there are any questions about this All of Us study that you have, please reach out and get the information you need so that you can make a comfortable recommendation to your patients about participation.
Thank you so much, Dr. Simon. Dr. Roman.
Yeah, I can't express how excited I am about the program, and everything that the other panelists have said is spot on with why this is such an important program. I mean, we do nurture a lot of our relationships with the community, with our participants. You know, we have participant ambassadors who really give us feedback on the participant end of it. We have researchers that come to us and give us feedback directly on the data, the tools. We want to make sure that everyone involved is feeling represented and feeling like that their needs are getting met on all ends of the spectrum. And so I think this is a really great opportunity to dig into the data that we need to make these, you know, advancements in and I think this is really the perfect platform to do it. And so, I can't speak higher than what we've already been talking about this program and the opportunities it provides.
Well, thank you so much to Dr. Roman, Dr. Simon, Dr. Lozano, and Dr. Wallin for the amazing presentation. I think that inspirational to hear what all of us is doing, to hear why it's important to increase underrepresented minorities in all of this research. And now is to put in practice what we have learned and trying to communicate others this. I want to mention that our next Fireside chat session will be May 27 from 7 to 8 p.m. Eastern time on women's health. And if you want to know more about All of Us research program, there will be an exhibit on the National Hispanic Medical Association annual conference from March 17 to March 20. So in the chat box is the registration for that event. So if you want to know more, it's that. Really, to finalize, I want to thank the National Hispanic Medical Association for putting this together and for bringing such amazing panelists to this session. And it was a real pleasure. Please stay safe. and bye-bye.